taking this page.
Okay, good afternoon, everyone. This afternoon, we're going to be taking a look under our oversight and accountability section. We were preempted by the governor, our standing 1 o'clock agenda item. You know, the governor had some important stuff to say, so we had to listen to him this afternoon. And so our O&A got switched to this afternoon after his budget address. And luckily, some members of his cabinet were in the building, so it worked out okay. But I would like you, if you could, go to the committee's webpage and look under today. And I want to just give you a little bit of background on what we're doing here this afternoon. And then the witnesses will ask the witnesses to come up.
Agenda or handout?
No, just go to where it says Tuesday.
There's only one thing there, it's Katie McClellan.
Okay.
It's under Katie's name. You see where it says Katie McClellan?
On the document, okay. Get back out of here. There's a document.
Okay, you see Katie's name?
Yeah. What?
Got it.
Scrolls out of that.
You got it, Todd?
Yeah.
Awesome, okay.
And-
Everything.
I have faith.
Witnesses. And here we are. Oh, the only one that's that she was there.
Sorry.
Katie.
We're gonna read that.
Okay.
Okay, so what this is, in the budget, a couple of years ago, there were additional positions. Actually, it was kind of a restoration of positions. There were positions that the Department of Disabilities, Aging and Independent Living had some years ago to provide quality assurance and improvement for our designated and specialized service agencies. And over the course of time and through different budget issues and cuts and all of that kind of stuff, those positions had been reduced. And it became apparent to the legislature that additional attention and oversight to designated agencies was important. And particularly because designated agencies for people with developmental and intellectual disabilities, they provide a significant amount of residential services, which is 24/7, 365 days a year responsibility for people and their lives. So you can see here that under that section, there were 5 Dale positions created in that section, and that they were dedicated exclusively to the Developmental Disability Services Division of the department around quality oversight and on-site visits. Part of the requirement is to have on-site visits at least annually to each designated and specialized service agency. And we're looking at the assurance that the standards for home and community-based services are being met. So we put millions and millions of dollars into this system, and frankly, the amount of oversight we have. At one point, I calculated it was way less than 0.5%. It was a tiny amount. And it's because that part has grown. I'm sure it's probably more like even more minuscule. We'll calculate that at some point. So anyways, I just wanted you to have that background. So that's why we're doing some oversight. Of course, it takes a while to hire positions, takes a while to move into, what are these positions going to do? And I don't know exactly what the department's going to say, so I should just be quiet now and let them talk about what's happened in the intervening time since this was done. So welcome.
Thank you.
And if you want more than one person to sit up there, there's a folding chair there. I think you can.
There's another folding chair.
And this is your first time in committee this year, right?
I mean, committee ever.
Last year.
No, you were here last year.
I didn't testify, I was just.
Oh, you just- oh, yeah.
It just arrived.
And
that was it.
So just your first time testifying.
Yeah, it's like on your first, second day.
Yeah.
Yes, so that was like, just had my eyes on it. Rebecca said, come with me.
Yeah.
I'm like, okay. So I've been in this room, but this is.
That was
I'm in
interesting.
front of you.
Oh, well, that's awesome. Well, we'll take a moment and we'll go around the room and introduce ourselves. Teresa Wood from Waterbury, and I also serve Bolton, Buell Score, and Huntington. I've lost track, so I'm going to start the week on the left.
I'm Garofano, nice to see you all. I represent Essex and Essex Junction.
And Jubilee McGill from Bridport, and I also represent Middlebury, New Haven, and Weybridge.
Hello, I'm Esme. I represent Hartford.
My name is Zahn Eastus and I represent Guilford and Vernon.
Hello, I'm Todd Nielsen. I represent Brandon and Forrestal.
Doug Bishop, representing Colchester's Chittenden 20 District.
Brenda Steady, East Milton, Westford.
Hi, good afternoon. Eric McGuire, Rutland City.
Good afternoon, Dan Noyes. I represent Wolcott, Hyde Park, Johnson, and Belvedere.
Ann Donahue, Northfield, and also Berlin.
I'm your horse committee assistant.
Great.
Rebecca Silvernagle, principal assistant at DAM.
And you might say who you were, and then I'll give a little intro.
I'm Jennifer Garabedian. I'm from Dale Developmental Disability Services Division Director.
Hi, so
And we have Jeff online if you want.
Jeff, say hi.
Hi, everybody. I'm Jeff Dunamaker. I'm the Developmental Disability Services Division Assistant Director.
Great.
Thank you.
So I'm Dr. Bowen, Jill Bowen. I am the commissioner for Dale. It's been about 9 months now. I have met many of you, either by having a meet and greet or on my listening tour. I've been to pretty much every one of your places that you've mentioned, all over the state to try and get to know where the services are happening, put my eyes on it, get visuals for understanding where the services are being provided, getting to talk with the providers in all corners of the state and also the people that we serve. And so I have learned a lot. I've been to about 40 or so programs that Dale serves. There are probably a couple of hundred. So I'm keeping on going. I don't care how long it takes. I'm going to get to everything. I have learned a lot, been to virtually every county, and it is informing my understanding of the work that we do. I do come from originally from New York. People can tell immediately when I'm speaking. And I was most recently commissioner for Philadelphia's mental health, substance use, intellectual disability system and their Medicaid system. So, and in New York, I worked for the mayor, and I worked for most of my career. I am a psychologist by training in public health. So that's what I bring. And it's been very informative for me, but also just learning the Vermont system has been amazing. I am very happy to be here in spite of all the many, many challenges, in case you didn't know that there were some. But it's also pretty amazing. Dale is amazing. The leadership team is incredible. And people work extremely hard on behalf of the people that we all serve. So that's my little introduction.
Great. Thank you and welcome.
Thank you.
So the floor is yours, and happy to have you give us an update on the departments and specifically the divisions, quality assurance and improvement. And also just as an FYI for folks, in the previous year, we also increased QA and QA activities at the department in the division of licensing and protection. We added a significant number of staff, and that was, again, in response, not only in response, but to the state auditor's report and looking at oversight of residential care facilities, nursing facilities. And so we upped the number of staff there. And then the succeeding year, we did it at the DD Services Division. So
I want to thank you for the auditor's report response, because they gave a very good follow-up
Yes, saw that.
Yes, so they were very pleased with how quickly and effectively that turned around, and it's not in no small part to the resources that you provided, so appreciate that. So I get to have the celebration. I wasn't here for the problem.
But you get credit for the results.
I do, I try not to take that. So are we up, Rebecca, with the slides?
Yeah, right.
Okay, great. So we're happy to talk to you about the Department of Disabilities, the Division of Disabilities Quality Assurance program, and you gave a summary that just is completely in alignment with the summary that I have.
This is on your webpage, committee members, if you want to look at it close up.
So are we up?
Yeah.
Okay, fantastic. I do, in spite of what I have said to my kids, I do not have eyes in the back of my head. Okay, so it is a requirement for us to maintain a statewide system of quality assessment and assurance for services provided for people with developmental disabilities. Make sure that we're providing quality improvement support, ensuring that the service, the principles of the services are achieved. So we do have 10 developmental disability services division staff on our quality management team. And this is the breakdown: quality management team lead, 7 quality management team reviewers, quality management team nurse specialist. You see the vacancy there. That is some challenge around nurse and nurse recruitment. I'm sure you are aware of that across the board. And a position under reclassification review.
What is that? I mean, I know what reclassification review means. What is that? Is that an existing position that you're just reclassifying?
You want to explain why that? Yeah. go ahead.
Yeah, so we're looking to restructure our quality team, and we're reclassifying that position to be an assistant director of quality with such a renewed interest in quality, both at the federal and state level. We'd like that position to be more forward thinking, to ensure that as we continue to evolve, that it has a more it has more evolution to our team, ensures that we are always on the cutting edge, that we're looking to be more proactive with our quality assurance and improvement, that we're working across the agency and looking to be sort of an early adopter when it comes to work at the federal level. So we want that person to have a lead with policy and data as it relates to quality assurance and improvement.
I just want to highlight Jen's leadership on this. She has put together a really good plan for how to be ahead of the curve. And this is one of the pieces of the kind of rethinking of the quality team. And what this means is that once that reclassification is completed and approved, she'll recruit for that.
That person would still continue to work to ensure that our team is meeting the requirement for annual on-site reviews with our designated.
So they may still have some time in the field.
They would, absolutely.
It's a coach player.
Yeah, exactly.
Okay.
We want them to stay true to that as well, but also.
Answered my question.
Perfect.
Okay, so next slide gives you.
I'm sorry for interrupting, but
Interrupting.
interrupting to ask, do you want to take questions as you go, or would you like to get through your presentation and then take questions?
Fine to do a conversation
Okay.
around it, okay, in real time, that's fine. So the quality management team over time is what you have explained. So pre-2008, there were 2 quality management teams, and they included the team lead, the specialist, the children's specialist, employment specialist, and all the training specialists and a nurse. That did allow for annual on-site reviews of each of the 15 provider agencies and the supportive intermediary organizations. So that was the pre-existing before the 2008 to 2022. So in 2008, there was a drop in the number. This is what you were alluding to, the reduction in the budgets that led to a much smaller team, and of course a decreased ability to provide the level of quality oversight. So then it went from 2 teams to 1 team. Reduction in the staff resulted in reduction in number of positions. And it was reorganized to create a specialist team. So there was some still quality activity going on, but at a reduced rate, a reduced frequency, and with a smaller number of people. And then in 2023, with the help of the legislature and this committee, there was the establishment of the additional positions. I believe that might have happened in 22, but by 23, there was work that was going on to try to recruit. Right?
23, I think.
It was just, okay.
Fiscal year 23.
Yeah,
It took-
calendar year
It took
23.
the 6 months from July to December to do the human resources processes. So it was really the beginning of calendar year 24 that we were recruiting and hiring. We've had the additional staff for approximately 1 calendar year.
Right. And so that's where we bring up through to 2024 on this flow with the 10 positions, and we're able to return to level prior to 2008, which means we're able to increase the frequency and the intensity.
Go ahead.
What exactly are you inspecting? Is it like big buildings, is it homes? What
So
what is your thing?
they getting younger and younger. Hi. So it's a whole system of care with a continuum of services. So maybe you want to describe that.
Yeah, so each person who's involved in our home and community-based services gets an array of services, which is customized to meet their individual needs. And so it could be that an individual is having a review of services that include, as the chairwoman said, residential supports, 24-hour home supports, community-based supports, employment supports, their service coordination. So it could be a robust package like that. It might be a less intense level of supports because they have natural supports that are providing a high level of care to them. And so it might be fewer paid supports, but, and so we try to review a mix of all of those kinds of supports when we do our annual reviews.
So I'm going to stop
That doesn't exactly
that.
answer my question. I was asking where these people, are they in an institution? Are they in a
No.
home?
Oh, these are.
I don't know.
No, I know, it's.
The combination of designated agencies and specialized service agencies to provide the care at a variety of places. Home and community-based services is the highest level of care, which means that most of them are, if they need that level of intensity, they are in a, many of them are with a shared living provider, for example. So that would be the home that they're residing in. They may be in some level of a group home. They may be living with family, or they may even be living independently. So there's a whole range of places where they may be. It's not an institution that's being taxed by this. It's the quality of the care and the services that are being provided, the variety of spaces in the continuum. Do you want to add to that?
Yeah, I was just going to say, Representative Nielsen, on Friday, we heard from Vermont Care Partners, which represents the designated and specialized service agencies. So they are all of the providers that actually provide the services that Dale is responsible for overseeing. And so that's all done in the community. So I'm sure you probably have people in your neighborhoods that are folks with developmental disabilities that are living with other families, or could be living in their own apartments, that kind of thing.
I do.
Welcome. We closed, we had one institution in Vermont, and that was the Brandon Training School, as you probably know. I know. That closed in 1991. And so we in Vermont no longer provide services and supports for people with disabilities in institutional settings. We do community-based services. Yes, go ahead, Representative Bishop.
Just additional clarification on that. So do you identify a set of providers that you're going to go out and visit, or does it start with identifying an individual and then checking in on the services that are impacting, like you would look at perhaps the plan surrounding eye care if I was receiving it, and check with those various providers? How does it start?
Yeah,
I think we're gonna get to that.
Okay.
As I just kind of like flip through, why don't we let you kind of like go through the process a little bit and what you do and then,
But it's a great question.
yeah, it is, it's a good question because
May even answer it.
depends.
The next- Yeah, we will. The next slide. So this begins to go through the quality assurance responsibility. So there's the agency, the 15 agencies we talked about. 10 of them, I believe, are designated agencies, and then 5 of them are specialized service agencies. But agency designation, so the review of each designated agency and specialized agency is performed in a multi-year cycle. And this process is designed to ensure that needed services are available through local planning, service coordination, and monitoring outcomes within their geographic region. So they are regional, they're statutorily created, and they have responsibility to some degree. They're a safety net. They have responsibility to support the geographic area that they're assigned. So that's one responsibility of the quality assurance. Another is critical incident reporting monitoring. And these are monitoring of reports of critical incidents that are reported to the department. That's individual specific now, for example. And for someone who receives services for which there is a critical incident that has occurred, and they have to be reported, and then they're investigated. And grievance reviews are done, so that's also a requirement. It's part of the HCAR rule, but it's to review grievances that are brought forward. And then housing safety and accessibility review is to make sure that the inspections for all the residents, the people with developmental disabilities, again, not institutions, but the sites where they are residing. And then all of these are enhanced by the addition of a quality management team position. So we can go to the next slide because we're continuing to talk about the quality assurance responsibilities. Now we're talking about policy development and review. So we do participate along with the Agency of Human Services to create and review quality strategy and policy. That's part of the quality review is policy development and review. We ensure the compliance with federal requirements. We develop best practices, and when practicable, we align across all of the programs. We have subject matter expertise related to case management standards, quality management expectations, and we develop policies, and we are doing that as well as we move forward towards conflict of interest compliance and developmental services payment reform, which we can talk some more about as we go forward. There are also quality service reviews, where we monitor and review the quality of services provided using the federal and state home and community-based services, the HCBS funding requirements. We also check on the quality of the services provided by the DAs and specialized agencies to make sure that at least minimum standards are met with respect to the DALE and the Division of DDSD's guidelines and policies for developmental disability services. And we did return to annual on-site quality service review in calendar year 2024, which was one of the goals. And then training and technical assistance is an important part as well of the quality management team's responsibilities, which includes formal training around things like guidelines, rules, and regulations, but also technical assistance, which is incredibly important. And that might be in specific individualized cases where there's a need for some technical assistance to help, or it might be wider related to policy or systems or complexities in general.
Okay, before we move to the next page, can I check in around, I'm just, it just went through my head and in and out. Probably was. And
It's just something else, it'll come back.
It will
come back.
It will come back. Oh, I know what it was. Okay. So just this week alone, I've received 3 I guess you would call them complaints around not only the I guess it would relate to quality, but mostly around the quantity of service being provided, and people at least from the information I've gotten, and I haven't dug deeper into this yet, so there's always more to the story, but unilateral service reductions, without a change in the person's individual support agreement, so the agreement requires one thing and they're being told, I'm sorry, I'm cutting your hours in half. That was literally one email that I got just today. And so how do the teams address those issues when they're out there? Is that something that they look at? And do you have any data about what you're seeing out there in the field in terms of the, percent of services being provided versus that which is authorized and funded?
Yeah, so without receiving appeals or complaints, appeals or grievances related to those instances, it's really hard for us to track that information. And when services are reduced like that, agencies are supposed to be providing appeals notices, and then families have rights related to that. Certainly, if that's not happening, reaching out to us is really the best next course of action so that we can make sure that people understand what their rights are. So certainly, if you're getting that kind of feedback.
Yeah, well, we have gotten some too.
And
So,
we have to.
right,
we're
so,
following up.
Yeah, well, I guess I'm trying to get at, do quality assurance reviewers, when they're out in the field, are they actually looking at service plans, talking to recipients or family members or staff, and determining, whether in fact the services are being provided as they're supposed to be versus, maybe they're getting good quality but fewer hours, or, whatever. Are they looking at that, I guess, is my question.
Yeah, so our review process is both a survey of sort of satisfaction that is completed through interviews with the individual family or guardian as appropriate, the staff that work with an individual. So really getting that information based on, as you're asking, are people satisfied with the services that they're getting? And then a review done through records to understand sort of compliance and completeness of records. So there are both of those components.
so I would just say that the answer to that is yes, that's part of what they do, but I know that I am very much looking forward to payment reform, because part of what payment reform will bring is the ability to answer that question much more directly.
Exactly.
Okay, we will know exactly what people are getting in terms of the service. They will be paid for what they're delivering, and it will be a transparent and accountable process. Payment reform is a long time in coming. I know I'm arriving at the tail end of it, but it's been in play and developing for quite some time, and it's necessary to be able to answer those questions and be able to be more on top of it than they are. They are on top of it in the sense of, it's not a surprise to us to hear we get those concerns and complaints, and they do go right in and do a drill down. They'll go right in and try to figure out what is going on, that's what they're experiencing. And they'll do that on an individual basis. We recently got some concerns that came out of one of the advocate groups that had done their own survey. You may have also seen that same. So we've already scheduled a meeting with them. We want to understand exactly those folks that they are saying are receiving so few services, and we'll do a drill down to find out what's going on in that scenario. As far as these surveys that tell us whether people are satisfied or not with the number of services they're getting in the percentage, and all that's all helpful. Everything that we get from the quality team that brings us back information is helpful, but to give you a number, I'm looking forward to being able to come back here. The payment reform is in and tell you, 80% of the people are getting this percentage of it. I mean, we hear about challenges in the system since pandemic, and still coming out of the pandemic of some challenges in providing those services. Obviously, it's not acceptable to not be able to have the kind of services that people are choosing. Of course, there's a lot of choice in the system. It's a flexible system. The new system will also have flexibilities in it for people to choose what they want. Some folks want the maximum of what they've been authorized. Some want less, some want some parts of it, not other parts of it, and some want more. And so there needs to be built into the system that ability to both match what people's choices are, as well as to be able to have like exceptions and additions where necessary.
And to the commissioner's point about reporting, it will have better access to aggregate reporting, so across the system, as opposed to just on this sample basis where we're doing a look back, which will help us across each agency be better able to say, we can see X percentage of people are receiving less than 85% of their services. And these are the service categories in which we see there's real struggle in providing majority of services. How can we help you to better provide services, as opposed to now where we're looking back at services and saying, in this sample population, which is not representative of the whole, this is what we're finding. How can we help with this 10% of the population? So we will be in a much better place to.
I mean, they are doing sampling surveys, sampling size surveys, right? But they can even increase with the additional staffing that you guys provided, increased sample sizes, which is good. But once we get payment reform, we'll even have more tools at our disposal for really being able to give specific information about what's happening for each individual. So we're asking about individuals, right? Make sense?
Thank you. And well, don't worry, we're going to have you back about payment reform.
Yeah.
Well, I mean, you may love it, you may not, you may have mixed feelings about it, but it does give us that. It does give us that kind of transparency and view and, yeah. Turn it over to you.
Sure, happy to talk about quality. So talk a little bit about the agency designation review process. So as the commissioner said, we have 15 developmental disability services agency, which is 10 designated agencies.
Not one, right?
Not one, yeah. Not one, we have 10. Actually, we have 10. And
Is that what it says over here?
This is one, yes.
I'm gonna go on the board with this.
Yeah.
Right. Oh, we should have a prize for the people who find all of my typos.
All right. Don't make it a competition, because we're very competitive in this committee.
So we actually have 10 designated agencies. They are based on catchment areas, obviously not counties, and 5 specialized services agencies. I assume there's slightly different knowledge base in this room. So for those of you who are not as familiar as some of us, designated agencies, I think of them as like public schools. They have to accept everyone who applies. Specialized services agencies are more like private schools. They have the ability to say, we thank you for your interest. What we do here actually doesn't quite meet up with your needs, or thank you for your interest. We actually don't have capacity at this time to meet your needs. So they can be a little bit more selective when people apply for their services. But designated agencies allow us to have a 0 reject to 0 eject. And as the commissioner said, really allow us to have that safety net within our system, so everyone can have services when needed.
So for new members, it's probably important to know that in the origin of designated agencies is in state statute. So every part of the state is required to be covered in a catchment area that is assigned to a designated agency. So so every part of the state is covered. It's in statute, and the state is required to actually work with the designated agencies in the provision of these community-based services. That's a requirement in statute.
So right now we do our agency designation or redesignation process on a 4-year cycle. This has historically allowed us to have 2 quality review reports to include as we're looking at the redesignation to inform the process. But likely we'll be shifting to a new, like a 2-year cycle now that we'll have annual reviews. So we'll be looking at designation a little bit more frequently. And the good news is that we have finally have updated our administrative role on agency designation. It actually will go to the Legislative Committee on Administrative Roles. Actually learned it's going Thursday.
This week.
To go in early February, but I learned this afternoon. We're going Thursday morning. The update.
So it's every 22 years you do
Every
that?
22 years,
Okay.
yes. We are updating it after 22 years, and the focus of this particular update is really language modernization and bringing it current with our practices, adding things like cybersecurity, because that's a real thing, making sure that it reflects that there are two departments, jail and the Department of Mental Health. If you read the current rule, it still refers.
Mental health will be doing 2-year cycles as well.
They are currently on a 3-year cycle. They may actually remain with that because they have initiative. You know the initiatives? I don't know.
Community-based.
Thank you.
CBCH.
Yeah, community behavioral, certified community behavioral health clinics. I think that's what CCBHC stands for.
Yeah, we'll have to change that. Yeah.
Expanding it.
It's not up to us.
It's renamed.
It's been renamed,
Oh,
yeah.
DMH renamed it.
They did. I think you got right on that. You really need to talk to the rest of the country because I think they're still using CCBH.
Yeah. So
So I guess I would ask, is that going to be a problem for designated and specialized service agencies, you know, having disparate cycles?
yeah, we will solicit their feedback before we make a final change.
I hope
You're
not.
going, you're doing regulation review, you're doing regulations on Thursday.
So the current, the version that is going to LCAR doesn't reflect any difference related to shifting to a different cycle. It only reflects modernization of language.
Gotcha.
We will need to do another update in the next 12 to 18 months to reflect, and I apologize, I did not hear what the new term is, but what the new DMH initiative and changes related to conflict of interest. So when we update it again, we will reflect any changes we make. to
So I
it.
understand, because I know that I asked a few questions about this, that the decision was to move forward because it had been so many, you know, like a couple of decades with the old, to just modernize. So there's going to be just another one that's going to.
Yeah, I mean, I didn't have any problem with that. I was just looking, it says shifting to 2 years in 2025. That might be not exactly the right timeframe.
Right, we wanted to, and we will have to talk to DMH about it too, in terms of what.
I guess that's what I'm getting at, you know, the
Right.
collaboration
Yes.
across the Agency of Human Services and I, you know, we're also about efficiency and transparency with our community providers, and there might be a good reason to be different. There might not be a good reason to be different. So I just, it's just sort of putting it out there like it's a decision that's already been made. That's, I guess, was my question.
Well, yeah, and it really hasn't, but what I was trying to do is say, if you needed 2 reports and now you're doing annual ones, then you actually could go in at the 2-year mark, right? Because if you were going in at the 4-year mark, because it was every 2 years, you now could go in every 2 years because it's on the 1-year cycle.
Yeah, I get what the, you know, sort of maybe thinking behind it is, but again, so when things appear in documents, we believe them, okay? So, and we believe them to be what is going to happen.
That's our intention. We do need to coordinate, you're right.
Yeah, I just, and there would need to be a regulatory change before you can do it.
Okay.
That's,
Okay.
Representative Bishop.
A request for the chair, and I think probably outside of this hearing, perhaps a little time on explaining the role of LCAR and things like that.
I can certainly do that.
That'd be great. And then a follow-up to your question, I'm sensing that these are not spot inspections, that there's work done by these agencies ahead of time. Is there a report that they complete prior to this review when your staff shows up? Something that takes multiple staff members many days or weeks? Is there any sense you can give us as to what that looks like?
Yeah, so a designation review does require, it's often submission of information in advance. There is a process where team members do go and meet with staff. The agency designation process is a little more administrative than the quality review process. It looks at bylaws, it looks at board makeup, it looks at standing committee composition, things like that. There's a review of job descriptions, things like that, to ensure that the agency is adhering to different requirements that the departments have related to that. So it is a little bit more administrative in that capacity, but also how the quality of services and how individuals and families, people of all kinds of lived experience interact with the organization is taken into account.
So I guess the answer is both.
Yes.
Is both the actual on-site experience
Right.
and then, but there's some prep beforehand.
Okay.
Can we move on?
Yes, thank you.
Okay.
So as the commissioner mentioned, critical incident reporting is part of our quality assurance process. You can see that critical incident reportings are reporting of incidents that occur for individuals receiving our home and community-based services. That the division has other services that we oversee, but we do primarily receive reports of incidents for our HCBS supports.
I'm sorry, could you say things as opposed to
I'm sorry.
abbreviations, just because it's new for
Yes,
some
I
folks? Yeah,
apologize.
no, it's okay. We all do
I like
it.
to say, yes, it is our home and community-based services. Our guidelines require that these incidents are reported within 2 business days of learning of the event, with the exception of when an individual passes away, if the individual is a missing person, or if there's a potential media involvement, death, a missing person needs to be reported within 24 hours, and a potential media involvement needs to be called in directly to me. And then our staff review and follow up with the agency as appropriate. You'll notice that there have been an increasing trend in the number of critical incident reports that have been submitted.
Pretty dramatic, actually.
Well, we're gonna
Yeah.
take
So
a
I
minute
was
to
gonna
dive
say,
into
yeah,
that.
Okay.
Rebecca
Because we
would
want to know why that
move it
is.
to the next slide.
Okay.
But,
That's significant.
Okay. All right, so we have seen a steady increase in the reports of incidents over time. Certainly, we had a significant increase in submissions in fiscal year 21 due to the COVID pandemic. Some of that was of our reporting requirements. We did require reports for testing and positive incidents in COVID. So there was a pretty dramatic increase in fiscal year 21. So during that time, our team responded by an increased frequency of meetings with our provider agencies. They met on a weekly basis. So each of our staff are assigned as sort of a quality point person with each of our designated or specialized services agencies. If I said that in a way that's clear. So each staff had a weekly meeting with each of our designated agencies so that they could be in contact and have clear communication, follow up with any trends that were being seen, make sure that people understood sort of what
15 meetings a week.
15. No, see, I didn't say that clearly.
That's all right. We understood
Okay.
that staff were in constant contact with
Right, yes,
designated and
Making sure
special
people
services.
understood what like current protocols were, understanding what needs were, making sure people had what they needed, those sort of things. That has obviously scaled back since we've moved from COVID response to sort of our current state. And now we've sort of been trying to understand what the current additional contributors, the increased incidents are within our programs. some of that is just, we have an increasing age of our population of individuals served. When we look at the demographics, we see that we have a pretty significant number of people in the younger age cohort, but then also people who are aged 50 and above. So as people are aging, their needs are increasing. So we're seeing a lot of reports related to medical incidents, things like that. But we're also just seeing a general increased acuity of care for individuals, a lot of complex medical needs, a lot of complex behavioral and mental health needs, a lot of co-occurring needs, similar to what we see in the general population. Additionally, we're seeing challenges related to health-related social needs and inflationary pressures. So as Vermonters in general are struggling to find housing, stable employment, and other factors, we're seeing that within the developmental disability services population. Another factor for critical incident reporting increase is an increased awareness of the need for submissions. These requirements related to Center for Medicare and Medicaid Services Assurances, which is a requirement that we have with the federal government. We tied submissions to value-based payments in their provider agreements and increased interactions with our quality management team. So just general reminders that this is something that needs to be done. And after these critical incident reports are submitted, our team follow up directly with agency staff regarding specific incidents. So really just making sure that people understand what happened, what the next steps are, and how to ensure that similar situations don't happen in the future. Looking at trends also helps us identify areas for training, be it around behavior support, trauma-informed care, or just generally submitting these critical incident reports. So we've talked a little bit about how the quality services review process worked. We have outcomes which are measured through a records review, which is a review of electronic medical records housed at our agencies, where we assess the quality of the records, such as individual support agreement, the needs assessment, behavior support plan, and determine the compliance with rules and regulations, as well as the interviews that I spoke about. This results in both qualitative and quantitative data.
That's some of where you get the data you were speaking about earlier, through this review.
Do all of the designated and specialized service agencies have electronic health record?
No, we actually have one specialized services agency that still uses paper records, and our supportive intermediary services organization Transitions 2, which is the organization that supports individuals who self and family manage their services. They don't have an electronic medical record.
Paper.
It works for some people.
Yeah. We have about 90 individuals and families who self and family direct, so that is at least a fairly small number. And specialized services, like specialized community care. I always want to say yes. That's the specialized services agency. I think they support about 80 people. They're also fairly small. So we have 9 quality services review outcomes. 8 of them are done primarily through survey. And during that survey, our quality management reviewers determined the level to which individuals feel that these outcomes are met. Outcome number 7, well-being, also does have some quantitative aspects to it. Outcome number 9.
Can you go back for a
I'm
second?
so sorry,
Because
yeah.
I do think that from 1 through 8, you were saying that most feel that from the results of the survey, the outcomes were that most individuals feel that they were being treated with dignity and respect. and that they direct their own lives. So these are mostly returned with positive results or
Yes.
positive
Yeah, I'm so
outcomes.
sorry, yes. thank
Yeah,
you.
no, it's important because this is data that speaks to some of the questions about, do they feel they're getting sufficient services, and is this working for them essentially?
Yes, we do get, we tend to find that people do feel positively about these survey outcomes, that in general, people are satisfied with the level of supports that they're receiving, the quality of the supports that they're receiving.
So these look similar to areas, from my recollection, at least, of what similar things that National Core Indicators surveyed when Vermont was part of that. And National Core Indicators is it's a process and a tool and that other states use in order for them to compare themselves in their state to what other states are doing. And Vermont discontinued that back a while ago. And I am just wondering what efforts is the state making to, somehow participate in a process that enables us to see how we compare to other states in our performance.
So first of all, I wanted you to know that I've asked folks to tell me why they're not participating and whether what would it take to participate again. So I want to understand that because I'd like to actually be part of that. I've reviewed it. I can see what the other states are saying, and we have our data we can see. But I just want to understand why we're not part of it and see if we can become part of it again. It sounds like you're recommending that would be.
I have a bias towards that. I mean, I think that we can sort of be particularly insulated, when we're only looking at ourselves, comparing ourselves to ourselves. And I think it is important to understand, both from a systems growth perspective, and it's, I participated in it on, sort of both sides of the equation, helping to do it as well as, administering it. So I think it's valuable, a valuable tool that helps us to see, where we stack up in terms of, the quote unquote industry as a whole, I'm looking at it. And I don't know now how many states participate and all of that kind of stuff.
This is for a number. I mean, because I was just reviewing it recently, and I asked, and I said, can you come back and tell me what it would take for us to rejoin it? So it's interesting you raised that. But I'm interested nationally. I'm also interested in New England. Like, just can we compare, and how can we compare to services provided? CMS has a lot of data, so we do look at a lot of that. We participate in all of that because we have to submit. So have been looking at a lot of comparative data across the board for older Vermonters as well as for those with disabilities. So we do have some ability to do that. I'd like more of an ability to do that. To be clear on what claims data could provide to us. And, I know that there's some infrastructure build, IT wise internally happening that will be helpful. But to your point, yes, we are interested and we are looking. The CMS data is very helpful because there's a whole array of comparative data, and that's helpful. So we are trying to understand what our challenges are versus what the national challenges are and what other local states' challenges are. And they're not, we're not alone in what we're dealing with here.
Right.
There's always a Vermont specific, challenge, but we want to compare to other rural states. We want to compare, among the different.
Yeah, I mean, I appreciate the fact that you're looking back into that and seeing what that might take. I think from my experience with it, on both sides of the issue, I think it would be a valuable tool for y'all.
I love data.
All of us.
I really do. I'm like,
Well, and, it's based on, at least it was, I don't know if they've changed the process, but it's based on consumer interviews. So it's a direct response from the people that are being served, and it's independent of the agencies that are providing it, independent of the state. And, there's just a lot of anxiety out there around the systems changes that are happening. And, there is some baseline data to go back and look at, a few years ago. And then maybe to compare as you change your systems.
Yep.
We're in the process of some major systems change. That could have some positive impacts. It could have some negative impacts. And as a state,
We need to know.
you need to know.
Absolutely.
We all need to know.
Yeah, agreed.
Thanks.
Yep. You want to do this one?
Sure.
Okay.
Great. So then, outcome number 9 is our systems outcome, which is determined through the comprehensive review of these electronic records. Our team has consistently noted the need for agencies to improve timeliness of assessments and service plans, a more personalization of individual service agreements in accordance of individual support agreements, in accordance with those guidelines. Strategies include technical assistance around measurable outcomes, data to be collected and tracked, complete outcome reviews performed on the timeline identified, and timely and completed needs assessments and periodic reviews of the needs. Additionally, they noted internal quality assurance staff to have continuous development and continuous improvement and mentoring, especially for effective supervision and mentoring for service coordinators. These outcomes and trends drive our technical assistance and training. Our team offers these trainings at least annually, especially related to the individual support agreement guidelines. We are particularly encouraged that conflict-free case management is coming because it's going to bring a specialized organization with increased capacity to focus intensively on person-centered planning and the timeliness of necessary assessments. As the commissioner has mentioned, payment reform will provide increased transparency and accountability related to services provided.
Sorry, we're distracted a little bit because all the Medicaid portals have been shut down
Across the country.
across the country,
Medicaid, Head Start, health centers.
in addition to everything else. So, sorry.
Housing vouchers.
Yeah,
Yeah, but now the Medicaid portals.
Medicaid was originally exempt and now everything is,
Their portals are,
Yeah.
been closed down.
sorry. That's, it's distracting.
Yeah.
Sorry, everybody knows that's a big deal. Okay, go ahead. Sorry. Did you have a question? Go ahead. Doug.
Yeah, just that there seems to be some focus and emphasis on the help that will come from conflict-free case management. Is there a quick and easy explanation of conflict-free case management?
Yeah, sure. So conflict-free case management is an initiative that we're in the middle, near final stages of, where we're working to tease out the case management responsibilities from our designated and specialized services agencies from what they call service coordination. So that's a larger set of
Let me
responsibilities.
just say it's a CMS requirement. We're out
Yeah.
of compliance. We have to do it by a certain time or no good.
Okay.
Yeah. But-
And every other state has done it. Like we are the last ones to implement it.
And it will pull out some of these administrative roles, including person-centered planning.
Person-centered planning, administrative.
Well, no, but there are other administrative roles.
Sorry, Jennifer and I know each other from way back. Being a little informal. Yeah.
Not so easy.
Too informal.
It's like the note-taking is administrative.
But basically, it's to separate case management out. There's an inherent conflict if you're making the assessment and then you're also providing the service. So it's not allowed.
I feel like you're gonna smack me upside the head.
If I was sitting in Doug's seat, I would, but I'm not.
You're very lucky.
So just to clarify, I think I understood what you just said. So a portion of what that means is to separate out the assessment and then the ultimate delivery.
The assessment, the case management and the delivery are all separate streams now.
So, I mean, for people to understand, as Commissioner just said, it's a requirement that we're moving ahead. But for those of you who also talk to your designated designated and specialized service agencies, they're also very anxious about this.
Incredibly so.
As well as are some families, and other families are like thrilled about it, and other families and individuals are like very anxious about it. So it's a time of change and transition right now that is causing a lot of anxiety.
And we are putting out a communication in collaboration with the designated agencies to talk to, so that you're informing families and individuals who are being served. It's a calming communication to let them know that we're here.
So I know there was a request for proposals that was put out. Do you have a response? Have you selected a provider or providers?
So we did have a request for proposals. We are starting the process of contracting two entities. We're negotiating contracts with.
Okay.
Yeah, we can't say more about that, but it seems like it's heading to a good place. Yeah.
Okay, good.
So we have some lessons learned from our previous year's efforts. What we have learned is that the 2-year cycle is too long, and that we need to work more frequently to identify and address the issues as they arise. This is our way of saying, you were right. We do need to do annual on-site reviews. That minor issues can turn to broader systemic challenges if we're not working with the agencies to identify them individually. And that the length of time between resolving these concerns can lead to areas of importance requiring attention through a formal plan of correction if we don't just kind of go in, see what's happening, have less formal technical assistance opportunities for the agencies, which could also lead to impact in an agency's designation process. So again, if we don't just kind of go in early and often and work with agencies, it can snowball into a bigger issue. And so these trends have largely shown issues with some of these more case management related activities. I won't say administrative again. And so again, it just highlights the fact that moving towards conflict-free case management will separate out those challenges and allow a specialized entity to do that work, and designated and specialized services agencies to focus on the direct service that we do feel that they have the expertise in. So we are pleased for that. So as we've been considering how quality assurance and our two large initiatives, conflict of interest and payment reform, will impact each other, we developed an interim quality assurance process and thought about how conflict of interest will change the roles and responsibilities performed by the provider agencies. And activities such as intake, eligibility, person-centered planning, the individual support agreement development, and annual review, the needs assessment and periodic needs assessment of needs will transition from the designated agency and specialized services agency. And independent parties will perform these activities within our developmental services system to decrease partiality or the perception of partiality within our system to meet federal compliance. That having been said, our team will still perform quality assurance for all of these entities. So just because it won't be done by the designated or specialized services agency, we will have a process that incorporates reviewing quality for all of these independent parties.
So will there be, when you talk about that is, so I'm thinking about things like timeliness and adherence to regulatory requirements in terms of the length of time to process applications and eligibility and develop an individual support agreement and all of that. Are you anticipating needing to make changes to those rules around those kinds of things, or just that whomever it is that you're contracting with will conform to the current procedures?
Exactly. So yes,
The latter.
Yes.
Okay.
In fact, if you go to the next slide, you'll see the interim process already in play.
Okay, thank you.
And just to like put a finer point on that, Madam Chair, most of those timelines are set about by federal regulation, so we will continue to adhere to federal regulation. So for this calendar year, we did develop an interim process, which included an average of monthly on-site reviews of services at each agency. This ensured adherence with our statutory requirement to have annual on-site quality reviews. It increased our ability to provide technical assistance, training, and an on-site presence. And we did follow our same general process, which included the individual chart review as well as interviews with individuals and their appropriate circle of support. We were able to complete 81 individual service reviews in the calendar year. We hired our new staff, as we've mentioned. They were hired approximately a year ago, and we were fortunate enough to hire 5 people with a variety of experience working within the field. So we balanced our need to continue to monitor the quality of services with our upcoming changes related to conflict of interest primarily, but also payment reform. This new process allows for real-time feedback regarding services and any needs related to areas of improvement. And the increased frequency of visits provides more opportunity to work with service coordinators to improve processes and compliance. And we've received positive response to this new process from individuals and agencies alike, allowing for faster turnaround of feedback and any corrective actions needed. It's more nimble and responsive for agencies, especially related to their workforce challenges, and allows the ability to address challenges while spending less time responding to the actual review process by agency staff. Which then takes us to sort of the future of our quality services review process, which will be an expansion of the interim process and include an opportunity to gather input from our key partners, such as Green Mountain Self Advocates, the Vermont Developmental Disabilities Council, and our state program standing committee. We'll leverage the existing outcomes and be sure to use both qualitative and quantitative metrics, not the made up word I have there. Okay.
That's okay. Spelling, this isn't spelling.
We're only human. Thank you. We will continue to maintain our annual on-site presence for each agency and expand our review process to all necessary organizations. So again, all of those independent entities that will be involved in our system. We'll have a minimum sample size of 10% of each agency providing home or community-based services, or a 10-person survey cap. And really looking forward to a revised summary report. The summary report that we have now is actually pretty cumbersome and hard for many people to read, certainly not designed for the average citizen. So looking to really revise that, make sure it's written in plain language, have like a standardized rating system, kind of like a scorecard approach that makes it more accessible to people to understand the quality of services across our system.
You said 10, but you meant 40, right?
Oh, I'm sorry, a 10% sample size or 40-person cap, not a 10-person cap, sorry.
So this makes me think about the role of self-advocates, people with disabilities themselves in this process. And I know, sometimes interviews are conducted with them, their family members or guardians. Do you or does the team meet with almost every agency has some sort of self-advocacy group? Do you meet with them as part of this process to understand what sort of their perspective is as a group?
So I don't know that that's historically been part of it, but we got some good feedback during the development of the interim plan about what could be really useful in moving forward. And that sort of information was helpful, having a meeting, like a general meeting where public was invited to talk about the quality of services. So all of those things will be in a future.
And you did speak with Green Mountain Self Advocates. Did they also suggest that?
Yeah.
Okay.
Yeah, sometimes just there's bravery in numbers when people speak up when they're together.
That's a good point.
Thank you.
This the last slide is just to give you a sense of the timeline to incorporate the quality work with COI, payment reform, quality assurance in general, to look at the future state. So it just lays it out from the timeline. Yep.
Thank you both. This has been a lot of information, particularly for folks who aren't as familiar with the whole system, and there's lots of things changing at the same time. And I appreciate, when we look back and look at what was intended with the budget money, it appears that you've implemented the legislative intent and are continuing to refine that. And that makes, us happy with the aspect of, trying to continually improve the services for people with developmental disabilities and their families, and also to provide assistance to agencies when they are struggling to do the things that they want to be able to do. So glad you've been able to hire some folks that you're pleased with their experience, and so that's good. It's I'm just looking around to see if there's any other questions that people might have from the presentation. Yeah, go ahead, Representative Bishop.
So back to the discussion of the critical incident reports, and there was some reference to the potential that the aging population that's being served may be adding to a rise, if I understood that correctly. Would there be any role of the aging population of those who are providing care? Because many of these individuals are receiving a lot of care by family, relatives of some kind. Is there any role that
There's such an intersect between the two. There's not any question that the caretakers or the shared living providers or the families are very concerned about aging, and that we're seeing a shift in folks retiring from some of the roles that they're in, like the shared living providers, and newer folks coming in at a lower frequency, right? So more people are kind of retiring and leaving than are coming in to take their place, which is why different models are being looked at. As far as anything that creates transition or shift for folks is going to add to stress, tension. There's already trauma in the system people have experienced in the pandemic and coming out of the pandemic. The pressures, in Vermont, the floods, there's just so much trauma that people are experiencing that it layers complexities. We're seeing more complex presentations most places that we're looking. So this is no exception that we're seeing it pop up in the kinds of critical incidents that are emerging. You heard Jennifer speak to some of it may be an artifact of better reporting, but it doesn't account for the quality of what we're seeing. Someone might be experiencing some level of housing insecurity at the same time that they're experiencing challenges with their with their service plan, or so you're seeing multiple challenges across the board. We're seeing that in the older population in general, even without the co-occurring challenges that someone might have because, or consistent with their the older demographic and their disabilities. We're seeing it everywhere, and so are the hospitals are seeing it. So we do have this challenge in the system.
Thank you. I was just also wondering about the annual report. When would we be receiving that?
So we expect for that to be finalized by the middle of February, in line with the legislative report.
So I'm just curious if it was going to be on time. That's a place where it will be helpful for all of us actually to do a quick review because it lays out where we are providing services in Vermont, how many people are being served, what the definition of some of those services are, what some of the pressures are, all those kinds of things. So it's actually a pretty quick, easy read and give you a lot of background information, which we all will be needing as we look at the budget. So particularly for Representative Nielsen and Representative Noyes, it'll be a good, even maybe just taking a look at last year's annual report, which I think there's a couple of extra copies of floating around. Okay, thank you both for being here today. We really appreciate it, especially after, listening to the governor's address. And thank you, committee, for coming back. We're trying to jam a lot of things into relatively short period of time and to sort of help lay a foundation also for some of the stuff we're going to be talking about when we do review the budget. So really appreciate it. Thanks so much. Okay, so just to review, I'm just going to go back just for a minute because one of the things that we were doing just before we went online is to assign liaisons to other committees. And not everybody was in the room, so we'll go through that again. Meaning, yes, you, Eric, you weren't in the room. You did get an assignment.
It was hijacked.
Yeah.
In custody.
But it's a good review for us. So go ahead.
Sure. So I'll just review each one. Agriculture, food resiliency, and forestry is Esme Cole. Appropriation is Rep. Wood. Commerce and economic development is Rep. Bishop. Corrections and institutions is Rep. Noyes. Education is Rep. McGill. Energy and digital infrastructure is Rep. Eastis. Am I pronouncing that right? Environment is also Rep. Eastis. General and housing is me. GovOps and military affairs is Rep. Steady. Healthcare is Rep. Esme Cole with assistance from me. Judiciary is Rep. Donahue. Transportation is Rep. Nielsen, and Ways and Means is Rep. McGuire.
Great. So just to review briefly what the responsibilities for committee liaisons are. It is to take a look at their agenda, see what they are going to be taking up. If you have a question about whether there's any intersection with our committee, feel free to ask me or ask another committee member. It's also important for things that we take up here that they may not be watching, to let them know about those things. So, for instance, Esme, they were just talking about changes in the designation process. Okay, that impacts our colleagues in the healthcare committee because they deal with mental health, and it didn't seem apparent that they had actually had that discussion among both departments. So and maybe they understood that they couldn't implement that without a regulatory change, but I'm not positive. So again, that would be checking in. So I will be sending this list to the other committee chairs so that they know. Some folks have asked, who is our liaison, and other folks have it's not really on their radar. But so it's just watch their agenda, think about something that we might be doing that might impact them, and so also find out who theirs is. So hopefully this will prompt people to send me back. Well, oh yeah. Your liaison is so-and-so, okay? So, Commerce and Economic Development, Doug, we already know that is Representative Abby Duke, because she's the one who kept prompting me and asking me for my liaison list. So, you're one ahead. That's the one I know. Okay, all right. So tomorrow, we are going to be having a walkthrough by Jen Carby of H13. which is around Medicaid payment rates for home and community-based services. And then we are going to begin testimony on a bill. So on that bill. So, we will see some of the same people that we saw here today.
Yes.
Yes. And they will be here to speak to that issue. We're gonna take this up on a lot of testimony over the next 2 weeks. Then we have Public Assets Institute. They are a nonpartisan group that actually does a lot of research in some of the areas that we cover, and they asked to do a presentation here. So they got 45 minutes before lunch tomorrow. We have Mental Health Advocacy Day as well tomorrow. And so we will have individuals who are here. And we may also, have you had an update to this at all from people? Lori, not that, no, okay. The only reason that I'm thinking about that is because I thought we were going to have a self-advocate, an individual with lived experience in this area.
I was looking at like some of the other committees and all of them have Mental Health Advocacy Day and then it says TBA.
Yeah.
As to who the witnesses are.
Yeah,
And they were gonna have a press conference at one and then apparently that got canceled, so.
Yeah.
I don't know what's
I'm
going
not
on.
really sure what's happening, but but we will be having representatives, not exactly sure who all it's going to be. And then we will continue testimony tomorrow afternoon. And then after floor, we actually are probably not going to do FY26 budget assignments because they're the same as what you had for BAA. We're working with our colleagues in appropriations because we were actually wanting to get started on testimony, but they're not starting on testimony until next week on FY26 budget.
And we don't normally jump the gun on approach.
We don't, except, we do after the secretary delivers and the commissioner of finance and management delivers, then I'll have to double check with the current chair. The previous chair was fine with us scheduling ahead after they got the intro. But they haven't even had the intro. So
Can I just make a comment about budget work? So I have, and I'm happy to share this. I created like a template. So the B numbers, like as you're doing gathering your information for each line item. So you capture the B number because appropriation needs that in our recommendation. So I'll share that with the committee. So then you can kind of keep your recommendations in the same format, then Madam Chair can easily aggregate it and put it in that.
Appropriations appreciated that format when we did the BAA, so it was concise, and they were able to exactly go down through and each of their liaisons were able to find it. So actually, I'd like people to use that. And, if we have some sort of overarching things, we'll add a cover memo, but kind of use that template. It made it very helpful to them and helpful for people who want to access our information on the website as well.
So, Madam Chair, what you were saying earlier, would that mean that Secretary Samuelson may not be coming in?
She is not coming in. No, we are going to have additional witnesses around H13, which is the Medicaid rate bill. So we will be having additional witnesses there. So right now, at this point in time, after House floor tomorrow, I don't have anything scheduled after House floor tomorrow, but don't count on that as just free time. Although you might get a little bit of leeway because we all came back to committee today and nobody else did.
Yes, that's true.
So I might give you a little bit of leeway tomorrow and so just pay attention. Yeah. So, okay, anybody have any questions? Yeah, go ahead, Brenda.
So up here after 3 o'clock House floor, we don't come back up here?
Tomorrow, I watch for the agenda. I'll give you an update in the morning, but I think right now, because we came back and worked after this afternoon, you'll have it's my trade-off for you. We got the Dale people in. You'll probably have some free time tomorrow afternoon after the
I
floor.
mean, I'm fine, I just.
Yeah, no, that's what I'm just
We
saying.
can talk about it in the morning when we'll
And-
know more, but yeah.
Yeah, I, because of the timing, we've been working on witnesses to take up the 2 hours where Jenny Samuelson we had hoped that she was going to be here. And I want to be clear, it's not because she said she couldn't be here, it's because they're just haven't done the presentation in appropriations yet. And that usually happens first before they come here. So we've been working on witnesses for that 2 hour block of time to make sure that we have folks from 1 to 3 there, as well as we will be coming back after floor on Thursday. So tomorrow, unless you hear differently from me, okay, then we will not come back after floor tomorrow.
And I'll check my desk and my agenda.
Exactly. Okay?
Okay.
Any questions?